My name is Dr. Romina Gasemi. I've been in practice over 25 years. My clinic is on Venice Boulevard in Los Angeles, California, around Culver City. And every week, every Wednesday, I call it Wellness Wednesday webinars. I give back to the community by sharing my knowledge and experience in problems that people are facing. So I hope this is beneficial to you, and hopefully you'll get some benefits and seek care or become more aware in how to manage your own health, right? And if you have any questions, I'm available for telemedicine, and I'm also available to answer any of your questions. So at the end of this, you could send your questions and answers, and I will be happy to respond to them via email or via a chat line. All right? So let's get started. What exactly is foot pain? A lot of people mistake ankle pain with foot pain. If you have issues with your ankle, make sure you look at our previous webinar. You can find that on my website, thinkhealthy.com. If you go to products and information, or not products, but if you go to information, blogs, and posts and articles, you will actually find that over there. And sorry about that, they're having a little bit of construction, so we have a little bit of background noise. We apologize. So foot pain is any pain or discomfort that is in your toes, heels, and arches. So if you take your hand and put it on the bottom of your foot, so as you're sitting, cross your legs, let your right ankle sit on your left thigh, and take your left hand and put it right at the bottom of your feet. That area is exactly what we call foot pain. Now, the pain ranges anywhere from mild to severe, and they're usually short period of time or a long period of time, depending on the condition. But that three area, your forefoot, your midfoot, and your heel, are the three areas we're going to be discussing. Why exactly is foot pain such an important factor? Is because the entire weight of your body sits on your feet, and every step you take is a symphony between your heel strike, flat foot, and toe off. So that bottom part of your feet is the foundation of where your body stands, and every single joint, muscle, and tendon reacts to this foot stand, all right? So I can't emphasize the importance of the foot more, not just for the foot itself, but for the effect it has on the rest of your body. There has been cases that people with foot problem have had severe headaches. So if you're suffering from headaches and you also have foot problem, you might have a little bit of a connection there. They are, even though they're distally very far from each other, but they're definitely physiologically connected. So what are the most common causes of foot pain? So first you have to know, is it a lifestyle choices? If it's a lifestyle choices, we call them repetitive stress disorders, which means, or repetitive stress injuries. And those are typically acute conditions that become chronic. Okay. So wearing shoes that don't fit, that's one factor that usually starts the whole process. High impact exercises or sports, such as any kind of running and twisting, such as playing tennis, baseball, football, soccer, anything that's got to do with high, fast speed impacts and a stop rotation, right? Basketball and baseball, another one of them. And then plantar fasciitis typically tends to be something that is more of a chronic issue. We also have other causes that are more of a medical issues, not biomechanical. Biomechanical is caused by movement, whereas medical could be more of a systemic problem. So we're looking at rheumatoid arthritis, we're looking at obesity that's causing overloading and overpressure, gout, diabetes, psoriatic arthritis. And then let me stay there for a little bit. Arthritises are in two divisions. You have osteoarthritis, which is more wear and tear and is more of a musculoskeletal problem, whereas arthritis is a systemic problem, is a rheumatoid arthritis, and is subdivided into psoriatic arthritis problems. And psoriatic always is accompanied by skin condition. Ankylosing spondylosis that you see is more of an osteoarthritic condition. It's when the bones start to fuse together. For people who have rheumatoid arthritis, they tend to have a positive blood test. So if you're experiencing arthritis, make sure you take a blood test for a couple of reasons. One, you want to make sure it's not gout, because we look at your uric acid content, and that's always done with urine analysis as well. Rheumatoid arthritis is when I check the rheumatoid factor to rule out as osteoarthritis versus a rheumatoid arthritis, and there's medication for that. But for conditions that are osteoarthritis, sprain strain, repetitive stress injuries, and deformity of the joint, you're really looking at osteo. So here we go. Let's talk about plantar fasciitis. Your skeletal system are like stacks of Legos that are connected together, but that are held by soft tissue structures, also known as muscles, tendons, ligaments. Tendons are the end structures of a muscle. They're white tissue. And ligaments are white. They connect bone to bone, whereas a tendon connects muscle to bone. And the function of them are for two reasons. One, stabilizing the joints in order for them to have a range of motion. Two, allowing the joint to move, right? So let me show you how it works. The back of your Achilles tendon is an extension of your gastrocnemius muscle. So any kind of walking condition, running condition, can affect the integrity of this tendon, which attaches to your heel. Also, we know it as calcaneus, right? Then the connection between your heel bone and your forefoot, where most of your calluses are formed, that area where the beefy part of your foot is, we call that plantar fascia. It's plantar, so it's at the bottom, and fascia because it's a white tendinous structure. There's no muscles there, all right? And then and it's also responsible for cushioning of the arches of your ankle, right? And then you have the bone structures of your foot, which is your talus, navicular, cuneiform. All those are explained in the previous webinar. But let me simplify it a little bit and come off of that whole medical platform that I'm at right now. Your plantar fascia is affected by heel pain, especially when you're weight bearing. So a lot of times people who work in retail industry who tend to stand a lot, they end up having plantar fasciitis. So it's not a heavy activity such as an athlete or a runner. It's that micro trauma over a long period of time. This causes the ligament to inflame, just like any other factors, and the fascia becomes inflamed and it causes damage and pain. The problem is if you keep on walking on that foot, you keep pulling on the connection between the plantar fascia and your heel bone, and that's where you start calcifying the ligament. So that's where the heel pain or heel bone comes up, or heel spurs show up on an x-ray. Now, the people that are at a high risk of plantar fasciitis are active men and women, typically between the ages of 40 and 70. Especially women during late pregnancy, which kind of explains the fact that you're having an overload of weight, and unfortunately standing on one side versus the other for a long period of time makes one foot worse than the other. Overweight and obesity, again, goes to the biomechanics of the body and overloading a structure. And people with a variety of active jobs that involves them being on their feet a lot, like factory workers, restaurant servers, right? So look at the bottom of your foot. If you look at the bottom of your foot and you peel off the skin, this is really what we're looking at. We're looking at the heel bone, and then the plantar fascia comes up and like a tree spreads out so you could flex your toes, right? So this area is where the fascia starts having pain. It typically feels like either a gradual, it could be gradual and work its way up, or it could be more of a sharp pain, and it feels like burning at times. If you feel like a burning pain, that means you got severe inflammation in the area that needs to be addressed. And it already is affecting a neurological factor, because burning pain, no matter which part of your body, burning, numb, sharp, shooting, stabbing pain is typically a nerve pinch. Deep, dull, achy pain is typically musculoskeletal, right? So let's talk about when you come in and we'll do an exam, the first thing that we always recommend is to take an x-ray. Why? Because we want to make sure that there's no calcification in that heel bone. Remember how I showed you the tendon of the Achilles bone or the Achilles tendon, and I showed you the plantar tendon? When you have an abnormality in your function of walking or in your gait, that constant pulling on the ligaments insertions for plantar and Achilles are going to keep pulling on the bone structure and causing a calcification, and that's what shows up on an x-ray. It should be on the first picture, a nice roundness in your heel bone. But guess what? That little horn looking thing is, or spiky looking thing is called a heel spur. And I'm sure you can feel it. So the biomechanics of your body is going to take a severe impact on how your walk is, which means your heel strike, your flat foot, and your toe off. Those areas are easily going to be detected with inspection in an exam if you just look at the back of how a person stands from behind. So if you're by yourself and you want to do this individually, go ahead and put your phone on video mode, put it horizontally on a flat surface, and stand in front of your phone with your back towards your phone. And take a deep breath in, march in place, exhale, and stand comfortably like you normally would. And let the video keep rolling. Then slowly rotate 45 degrees, then slowly rotate 90 degrees, right? You can actually identify if your Achilles tendon tends to arch away or arch inwards. That means you're already having a heel problem, a biomechanical problem. Now, if you associate that with knee pain, hip pain, back pain, upper back pain, then you definitely have a functional biomechanical problem that needs to be addressed. So it's not just your foot. The problem is already gone somewhere else, or somewhere else is affecting your foot to compensate for the problem. Typically a lifestyle issue that could easily be solved. Don't stress about it. Just make sure you contact your doctor. So bad habits will affect the rest of your body. It's a kinematic chain. Now, here's another test you could do. Take your old shoes, especially hopefully like not flip-flops, but actually a shoe that you put on like sneakers or a dress shoes, and that has a flat surface, flat bottom, and look at the amount of wear and tear on your foot. So if you take this picture, take the normal and take a good look at that. If you stand on a wet surface and walk away, that should be your foot imprint. That's a normal biomechanics. And if you look at the wear and tear on an old shoe or pair of sneakers or flat shoes, this should be your wear and tear. If your wear and tear is anything other than that, it basically says if it's more on the outside, you tend to stand on the outside of your feet, so that's supination. That causes bowing of your legs, which affects your knees and affects your hip. You may be susceptible for sciatic problem or SI, sacropelvis issues. If you tend to have more of a wear and tear on the inside of your foot, that means your foot is on pronation, you have no arches, and your footprint would look like something like this. These are the self-tests you can do at home that when you come into the office and I check you, those are the little key things that gives me a little clues about how your body works. So I do have to share something with you. Being a chiropractor and being a biomechanics specialist, it's almost like being Sherlock Holmes at the site of an incident, right? So when you walk in, from the minute I say hello, my exam starts, because everything that your body expresses has a meaning. So I put all this into this funnel, put the information in and categorize it until I come up with a deductive reasoning based on your presentation, inspection, palpation, examination, and then diagnostic testing will tell me, aha, that's where the problem is, and that's where the cause is coming from. Because fixing the issue is one thing, finding the underlying cause is totally another thing. That's the difference between getting rid of a symptom versus correcting the underlying problem. Once you know the cause, you can go in and fix it, correct it, maintain it, and get out of the way. If you're only symptom-based, then you always go back and forth dealing with this situation, no matter where it is, and it comes back with vengeance. So, and that's typically shown as arthritis. Your body is a kinematic chain. Everything you do affects each other. So my recommendation to you and my giveaway with you at this part of this presentation is make your feet wet, stand on 2 pieces of white paper and look at your foot imprint. And that's it. That's your cue. Then do a posture evaluation on yourself, which is available on other webinars that are provided for posture. Or just look at your shoulder level, look at your hip level, look at your knees. Is your kneecap shifting outwards? Are your arches falling? Is your Achilles tendon shifting? Do you tend to stand with one shoulder higher than the other? Do you tend to stand with your head tilt? Especially if you have parents or if you have a loved one that doesn't have a good posture, you definitely want to check them, because its prevention is way cheaper and more effective results than trying to put out fires. So I created a kit that you could actually get at my website. It's called Think Healthy. These are the things that I have been providing or recommending to my patients over the past 25 years. If you have posture problem, get your posture kit. If you have neck issues, especially if it's radiating to your mid-back or your arms, get your neck kit. If you tend to have headaches, get a headache kit. But know that your feet are an indication that there is problem somewhere else. So if you're fixing one, make sure you fix everything at the same time and win the game of wellness. And with the fact that you're attending this webinar, I'd like to award you by offering you a $10 discount on whatever you decide to choose to purchase. All right, moving on. Exercising is, if you tend to be an athlete or exercise or a weekend warrior, make sure that when you're exercising, you exercise correctly to minimize the loading on your feet. So the muscles in front of your body balance the muscles in the back of your body. The muscles on the right side balance the muscles on the left side of your body. You are a 3 dynamic human being. Therefore, this is how your body system works. If you're working out your chest and your pecs, make sure you balance it off with your lats and traps and your glutes at the same time. If you're working your quadricep muscles, make sure you balance it off with your hamstrings as well as your traps. So always look at your body, exercise upper and lower body together, front and back together. So if you tend to be a person that sits in front of a computer or has a sedentary job, make sure you double up on your reps for your extensor exercises and try to do abdominal work that's more like full leg lift rather than ab crunches. Ab crunches do not help people who are sitting for too long. It actually causes you to have more back pain later on. Different topic, not going to go there right now, but I want to stay on that foot problem. Know that simple fact, exercise your front and your back muscle groups together and upper and lower together. You can alter your exercises day by day, but make sure you keep that synchronicity of upper, lower, front, and back. So going back to your foot, when you do have foot pain, what are the things that are the best way to relieve the pain? There's one factor about pain that I'd like you to take home with, and that applies to you, to your children, to your loved one. Practice PRICE. It stands for protect the area, rest the area, ice the area, compress it, and elevate it. That kind of sums it up, but let's dive into it a little bit more. Apply ice to the affected area, which is your heels. If you're having throbbing, pulsating pain, please, please, please ice the area for 15 minutes. Do not go over 20 because after icing causes vasoconstriction. Vasoconstriction reduces the blood flow. That's how you reduce swelling and inflammation. It also numbs the pain receptors, right? But here's the thing. If you keep ice more than 20 minutes, it reverses its action and becomes a vasodilator, which gushes more swelling in there. So be smart, ice 15 minutes, and you could repeat that every 45 minutes, all right? So taking over-the-counter painkillers are going to be extremely effective for alleviating pain. Typically things that are, I personally take ibuprofens because they're more of a over-the-counter, non-steroid anti-inflammatory. So I like those. Taking foot pads also prevents it from rubbing the area, protecting the area. Elevating your foot with ice is more effective than if you just put your foot on an ice pack. And try to rest as much as possible. And the other option that is more of a medical approach is utilizing non-steroid or steroid injections by your podiatrist or your orthopedic doctor or your PCP, your pain management doctor. Insoles and foots and type of shoes, I will talk to you later as we go on. So what type of shoes do you choose? There are three important factors that you need to consider when purchasing a shoe if you have plantar fasciitis. One, make sure it has an arch and heel support, because plantar fasciitis and foot problems are a strike of your heel aggravates your plantar area, and when you do flat foot and you toe off, those two areas pull the tendon, pull the fascia much more. So make sure that your arches are protected to minimize the damage on the foot. Then extra rigidity on the sole and cushioning on the midfoot. So that meaning that you protect your arches and then you make sure that you have extra cushioning on your forefoot. And make sure it has a soft impact with the ground. So having a nice, I personally like shoes that have a little bit of a arc shape. I think the first shoes that came up with that was the BTL shoes, and then Skechers took off with that. Those are very effective in for people who have plantar fascia problems because it minimizes the amount of heel strike, and they're extremely beneficial for your biomechanics. They're very good. These are a couple of things that I just pulled out for you from my research for this webinar. I hope this is effective for you. By the way, this PowerPoint is available on my website. So if you forget it here, you can always go back and visit us over there. What type of insoles do you get? So remember the three key points: your arches, your rigidity of this forefoot, and also the cushioning on your heel. Apply the same to the insole that you're choosing. I personally like Plantar Fascia from Dr. Schulz. That's the company I like the most. And I recommend it to my patients. You may want to talk to your podiatrist for getting a customized insole. Typically, they tend to be more rigid, and that's more for a condition, more acute conditions. These insoles are available on Amazon, sea of products, and check with your chiropractor who specializes in foot problems, or your physical therapist or your podiatrist. Okay. The reason I bring in the chiropractor and the physical therapist with your podiatrist together is because your podiatrist has their specialty as a medical doctor specializing in feet about the biomechanics of your foot. A physical therapist and chiropractor looks more of the gross body, the whole kinematic chain, also the other areas that are involved. So working with a doctor that look at you as a whole unit is more beneficial for you, or making sure that your podiatrist considers those factors as well. So what type of supports and braces are out there? If you notice, every single one of these supports are categorized into three parts. They're either semi-rigid, semi-rigid, and soft, right? And if you notice, every single one of them are trying to mildly stretch the plantar fascia, which is stretching the bottom of your feet, and protecting it at the same time. So these are the other braces that are recommended, but they include your ankle and your foot. So they're stabilizing the foot to its maximum benefit. What other things can you do at home? All right, let's talk about this. Remember I told you about the ice pack? You could also kind of do a little cheat sheet. Take an 8-ounce or a 4-ounce bottle of water, put it in the freezer, let it ice, and put your foot and roll your foot on it. Or that would be very effective because it reduces swelling and inflammation. You could stretch it at the same time, and it rolls and works like an ice massage, right? You could take a little baseball or a massage ball and start breaking down the adhesions that are being built up. You could do that seated. You could do that, put your foot in the air and just massage it with one hand like this person is doing with the ice pack. Or you could sit down and put your body weight on the massage ball and stretch it. Stretching on Achilles tendon and plantar fascia together is a very good to do a step stretch. Passive stretches are the ones that you do and you stretch your leg. Active stretches are the ones that are more on a step. If you stretch your Achilles and your hamstrings and your gastrocnemius all together, is going to be effective as well. So any type of stretching would help reduce the abnormal fascia that's being compressed. Another type of stretch exercise would be putting a little towel and try to pick it up with your toes. This is now bringing all the other tendons and muscles into play. So it's going to be very effective. Again, frozen roll can, frozen water. Resistive exercises are more when you're trying to strengthen the foot, not on an acute condition. It's more of a chronic condition. You can find a ton of these information, but one of the things that I would recommend to you is first, break down your self-management into 3 parts. First, manage the pain with ice. Protect it, rest it, ice it, compress it, elevate it. Then try to stretch the area by breaking up the adhesions. And these are stretches with either a band, which is more passive, with your hand, which is more passive, or against the wall or on a step. The third part of your exercise or your personal care should be about balance, because your feet are controlling the balance of your body with every step you take. So balance exercises of feet and ankle are extremely effective. So you could either do one leg stand with assistance, one leg stand with the other one elevated, and then eventually one leg stand on a Boso ball or more like a cushion, a wobble cushion. Again, look at the body compensations. Keep paying attention to your body as a one unit instead of a block of foot is not conducive or beneficial for you. It's most effective when you actually look at your body as a whole unit. Now, I want to talk to you about things that you do on a regular basis. Slouching in poor ergonomic position, and if your work environment has changed from a nice desk area with fantastic chair and properly ergonomically set up, and now you're kind of trying to find comfort in between the bed, the couch, the coffee table, the breakfast count, the kitchen counter, the sofa, please make sure that you keep 3 basic things in mind. If you're sitting, your torso and your thighs have to make a 90-degree angle. This is the most effective way of having your body position. And then before that, for a couple of years ago, a lot of ergonomists used to think that the computer monitor the top of the computer monitor should be on the top of your forehead. That is wrong, because biomechanically it causes straight neck. So you want to make sure that you elevate that, I'll fix this picture, you elevate that computer monitor so the screen is, when you're looking at the screen, your chin has to be parallel with the desk or with the ground. So if you use that, the rule of thumb, you adjust your monitor based on that. When you're standing, if you're having sit-stand desk, my recommendation is to stand during the morning and sit in the afternoon. Please do not stand 8 hours continuously, because you are loading and causing plantar fascial problems, knee or ankle damages, all right? And for ladies, this will cause varicose veins, and as well as causing aggravation in the pelvis function. Again, if you have problems, you have posture problems, please make sure you get your kit. It has everything in it. It has specifically products for strengthening your weak muscles, reducing the muscle damage to the tight, knotted areas, tractioning your spine, correcting your posture, and changing the ergonomics of your body. It's like all in one. We specifically identified took the best posture support that could benefit you. If you have flex bending account, you can use this towards your posture kit. because it has a specific product, which is this one. It's called BAX-U. It has BAX-U inside that is covered on your flex spending account, health savings account. I hope this seminar was effective, this webinar was productive, and you got what you needed to get out of it. I appreciate your time. And next week, I'm going to talk about vertigo and forward head syndrome. There's been higher causes of vertigo, dizziness in our young population. And young, I'm talking about somewhere between 35 to 65. We're having higher incidences of vertigo, unfortunately, and forward head syndrome, unfortunately. And hopefully the next webinar would be effective. So join me to see you and to share with you the knowledge, the information of what you can do at home. Please make sure that you take care of yourself, get your kits, get what you need. If you have any questions, contact us or ask your doctor to get your kit for you. Thank you and have a wonderful day. I look forward to seeing you next week, same time, same place.